question about the navigator, since I am technically considered a navigator. In order to be a navigator, you must have passed the state exam and also taken courses, federal modules that were required to be considered a navigator. My job is to actually sit down and help the consumer understand what their healthcare options are and help them get enrolled. I cannot necessarily help you choose the plan, but I can give you enough information so that you make a sound decision. The marketplace offers 4 categories of plans, also considered metal tiers. They start at the bronze level, which is the lower level. You'll experience a lower premium, but you may have higher out-of-pocket costs. The next level is the silver level. That level is considered the marketplace standard. If you make under 250% of the federal poverty level, you can realize some additional cost sharing in the silver category. You then move on to the gold category. You're paying about 80%. The insurance company will pay about 80% of your health care costs. You'll be responsible for about 20%. And then there's the top tier, which is the platinum level. The insurance company covers about 90% of your health care costs. You will be responsible for 10%. Would you like to add to that?
No, I think you covered it all. I would just let people know when we talk about, the federal poverty levels, in layman's terms, when you're eligible for the tax credits for a single person, that means that they make $11,500 per year, that they will be eligible most likely for a tax credit up to $42,000 or so. For a family of 4, that number would be $23,000 or so, up to $93,000. So if you're in those income ranges, you would most likely qualify for a tax subsidy. The lower you are on that end, the more tax credit you get, the higher you are, a little bit, but still something.
But before we go on, guys, can I ask one more question about the navigator? Say it's my grandmother, she's 75. How is she registered? She's not on the internet, so forth and so forth. How do we keep it simple for her?
Well, she's your grandmother, she most likely qualifies for Medicaid at 65. So
but what if she doesn't? Is it possible? I'm asking a hard question, because these are the questions every day people are going to ask.
Yes, there's no means testing for Medicare, so after age 65, she would qualify. But to get to people who are completely uncomfortable with a website, there is the 1-800 number. You can actually meet with navigators in person, and they can sit down and walk you through it face to face as well.
Okay, thank you. Thank you, Dr. Ramona, and thank you, Eric.
Well, formerly, the hospital has been the first line of defense for people with sicknesses. How many times have we seen people go to the emergency room who needed to actually just get a doctor's appointment a year ago or 6 months ago? Well, the Affordable Care Act now is impacting our hospitals in the region, and we're very fortunate tonight to find out what the ACA means for hospitals like Grady Memorial. Grady would like for Atlanta residents to understand how coverage through the health insurance marketplace impacts their patients, and we have the perfect person here, Rick Ryan, Senior Vice President of Revenue Cycle for Grady Health System. Explain, how is the Affordable Care Act changing the way you do business at Grady and hospitals across the country? Mr. Ryan.
Thank you. Thank you all for being here. The Affordable Care Act is making significant changes to Grady. When we talk about it being a game changer, it's certainly a game changer for many of our patients and the way that we do business. In the spirit of navigators, I'd like to introduce the 2 navigators that we have at Grady. We have Jamila Young has joined me this evening, and Kevin Humphreys in the back of the room. And these are the 2 individuals who are carrying much of the burden of carrying much of the responsibility, carrying much of the responsibility of educating our patients on the Affordable Care Act and how to access the exchange. So thank you all for joining me. So as Grade 2 has 50% uninsured patients, and the majority of our uninsured patients are below 100% of the poverty level. have to be above 90% of the poverty level to be eligible for an exchange. So a small percentage of our patients are eligible for an exchange. A significant number, but a small percentage. And we are working diligently to assist those people in accessing the exchange. For individuals who make less than 100% of the poverty level, they would have been otherwise covered by Medicaid expansion for this program, but for now in the state of Georgia, we do not have Medicaid expansion, and so those individuals will remain grading charity patients and covered by what we commonly refer to as the grading card. Individuals who do qualify for the exchange will have out-of-pocket expenses associated with their plans at varying levels. As Ramona indicated, the grading charity program will assist those individuals with their out-of-pocket expenses. We're still working on the details of that as we learn more about what the different out-of-pocket expense levels are for the plans. But it is our intent to retain the patients that have been so loyal to Grady and continue to offer them affordable health care options at reduced or no out-of-pocket expenses for the patients. So there's more to come on that. We anticipate having that done as quickly as possible, but we're still working with it. We have the 2 navigators that are working with us full time, and they spend 8 hours a day educating patients on the Affordable Care Act and the exchanges that are available. We are also training all of our financial counselors to be certified access coordinators who will also be able to help patients sign up for the exchanges. It is, even with a small percentage of the patients we have that qualify for the exchange, it's a daunting task. So navigators and the education programs in the community are vitally important to the success of this, as for you all in spreading the word and helping people understand. Patients are becoming more educated. We were talking earlier, the questions are changing. Rather than people assuming everything is free, they're coming in and asking questions about how much does it cost and what will it mean to me. So people are doing a great job with education, and everyone who learns a little bit can certainly help with that. And we appreciate you all being here and be happy to answer questions.
Thank you, Mr. Ryan. My sense is that there are 2 types of people here tonight. People who have individual questions because they want to know something in particular about the Affordable Care Act. And the second type, people who disseminate information to other people. You answer questions for other people in your organization, in your group, in your business. Because of that, and because you will come out on a Thursday night, the last night of Scandal, and be here with us this evening, I would like to open this audience to questions and have everybody, because I believe everybody has a question of some sort, we'll ask you to come to this microphone. Let's start the line now, as not to miss the first part of Scandal, and begin asking those questions to these experts who are here at our disposal this evening, ready to answer any and everything you may have to ask. Please begin now and make your line, and let's have our question and answer session begin.
Good evening, panelists. Thank you all for sharing the information. I have a question. You all stated that there were 4 different levels from the bronze to the platinum. As far as the co-pays are concerned, are they consistent? Currently, I'm working for a company and I will be retiring soon, and I'm kind of on the cusp of needing to go to the marketplace and exchange and get some affordable health care. I'll be on fixed income, and I want to know pretty much if everything's set, or does it change between the different levels?
Yes, there are set co-pays. You will probably be offered a plethora of plans to choose from. You have to look at those plans in detail, pay attention to the deductible amounts, your maximum out-of-pocket costs, as well as co-insurance and co-payments. But there are fixed co-payments ranging anywhere from $15 to $30 for a primary care visit, very similar to the insurance, private insurance plans that are available. You have Blue Cross Blue Shield, Kaiser, Humana, Alliant, and Peach State. These are all the same plans offered outside of the healthcare insurance marketplace as well as offered in the marketplace. The only difference is you're incentivized with a tax credit if you purchase through the marketplace.
Okay, and as far as the doctors that my wife and I have, will they still be a part of that network once we make the transition?
That depends solely on the plan you choose. And at the time you explore the plan, you can click on providers and type in your provider name. That's a very good point that you brought up. Someone was looking for a provider at our community health center, and we have only one provider name listed for the various plans that we are associated with. So you may need to inquire further with the practice or the doctor's office that you typically go to and see what provider is listed with those particular insurers. So it's a very good question. You may not always find the specific name you're looking for, but they are part of that plan. Okay?
One thing I'd like to add, when you're checking out the plans, if you take specific medications, be sure and clearly ask if your medication is covered. Some of the plans have different formularies that are covered and not covered medications, so if medications are important, you be sure to ask that specific question.
I don't see anyone else in line, so if you just slip your hand up, I'll bring the microphone to you. Yes, ma'am. Give us your name, please.
Good evening. My question is, I had a senior citizen, and she has Medicare, and she was wondering if it's like she could get a Medicare gap or something that, that's similar to the type of health care that goes along with that, or just Medicare.
You understand the question, Alice? Would like to take that on?
The marketplace is designed for those between the ages of 19 and 64. If she's currently receiving Medicare, there's no benefit to her going through the marketplace, and there is not a gap coverage of sorts that she can purchase.
You can purchase additional gap coverage and not through the marketplace.
And just another point, because of the policy changes under the Affordable Care Act, prescription drug costs are going down, including costs for seniors. So she probably has already seen some in her prescription medication costs.
I have another question right here in the back, and then I'll come to the front with this young lady right here.
Okay. I have two questions. What's most confusing to me is this taking the place of Medicaid? And then my second question is, when is the deadline that you have to enroll?
I'll take that. So this is not replacing Medicaid. So the Affordable Care, the term that's used is no wrong door. So if you go either online or through the various options to get enrolled, if you qualify for Medicaid, then you will automatically start that process. If you qualify based upon income for the private market, then you will be directed that way as well. And that process is what they consider to be seamless, meaning that you kind of, once you plug your information in, it takes you there automatically. In regards to the, one more thing about Medicaid, the Affordable Care Act does raise the eligibility limit for Medicaid. So for right now, if you're low income, you qualify for Medicaid. If you're moderate, then it's peach care. But although they're similar, they don't have a lot of the same protections in place. So the Affordable Care Act raises that up to about $31,000 for a family of four. So even the folks that do fall into the Medicaid gap, their kids will still be eligible for Medicaid. And so a navigator can help you with that. And so there are several deadlines. The open enrollment period, which means that you can come in as long as you're eligible based upon the income levels. You can come in throughout the open enrollment period, which goes through March 31st. The first deadline to get into that up until today was December 31st, 23rd, for coverage to start January 1st. But there was a bulletin released today that said that's been pushed back to December 31st, or at least the administration is giving an option so to the private companies whether or not they decide to go with that. And then thereafter, the 15th of every month through March, as long as you enroll by then, your coverage will start the following month on the 1st.
Thank you, Mr. McKay. Danita has a question.
I'm a part of a group that works with disabled children, and I heard you mention the age group was 1964, but we all got excited when we heard about ACA, wondering how it's going to impact them. A lot of them are so sick or disabled that they have reached a lifetime cap on private insurance in their children. Where do we go? Other than the resources I'm able to find for them, their families are still insured and the parents are still insured, but this child is no longer covered because of a disability. So other than resources I'm able to find, how can we use AC?
So, and they don't have insurance through a parent's plan? So you said they reached that lifetime limit?
I'll give you an example. I had a father who was working for a very small company, just like in the video. Because the child their expenses are really high, the company was no longer willing to cover that child for the insurance that he had. So the father was being out of pocket for almost everything that the child needs, other than resources they're able to put together for different charities and things like that. Is that type of person able to apply for coverage to these five insurance?
So for the 5 insurance, I would say yes, but my not knowing the particulars, I would say that typically children that are, disabled apply, they fall into the age-blind disabled category for the state. Well, no, not SSI, for the state. They qualify for Medicaid based upon that disability. I'm going to point out Whitney Horton from my staff, who works in the County, and CAF Medicaid also has, a requirement associated with the Affordable Care Act. And I'm going to encourage you to talk to Whitney so she can connect you with the folks in the CAF, because in my previous life, I worked with Voices for Georgia Children. And up until my left Voices in August, we were working on reforming the state's age-blind and disabled population. How children get into Medicaid and things like that. And I haven't kept up with it on that. But I definitely know that no matter income and things like that, the kids do qualify for Medicaid based upon that disability. And so I don't know the answer, but we're going to find it out for you.
I believe we have another question up front here, right here with Jackie.
They just began to survey everyone if in fact they wanted them to research the insurance company for this segment or so. Because then I now have to think about, should I go out on my own, have to balance my own account? Then I want to find out about the tax credit, the tax credit. If I use the entire portion of my tax credit at the end of the year, am I going to get a portion of it back on my return? If I have a job and the tax credit are going a certain bracket now, should I get it? If I change employment, then will I have to report the new changes of my income, and then will I then fall into a different bracket for the tax credit?
Right. I think I know what you're getting at. For the first part, with respect to your daughter, you have a couple of different options. Because the company you work for is so small, they don't have to offer you all employer-based insurance. They can decide not to do that and send you on to the marketplace. And that might seem a little bit scary at first, but as a worker at a small company, you will have full access to whatever federal subsidies you would qualify for. So you won't really feel any penalties in your own pocket. Of course, I'm sure you've probably heard that one of the new provisions is that adult children can stay under the parent's insurance until they reach the age of 26, which might be an option. Or you might want to kick her off that and send her into the marketplace to shop for herself. And she could do that. She could go and see what her options are, put in her income information if there is any. She might live in a state where she will become Medicaid eligible until she graduates from school and starts working on that. With respect to the tax credit, remember this federal subsidy is a direct payment from the federal government to whichever insurer you choose. So just like you would pay your monthly premium to the insurance company, the federal government will pay their share on a monthly basis to the insurance company. There will be an annual open enrollment period. I guess for next year will be October-ish or something, like October or something until December. So just like when you're working on a job and you've got an annual open enrollment, that will be the time every year where you can make changes to your insurance. I don't know, if you change jobs during the year, I don't know whether you can go and do a change of circumstance on the monthly.
Yes, any change that occurs throughout the year, you do want to report to the marketplace because it affects the amount of the tax credit you receive. And I believe where you were leading to is that if you took all of your tax credit at the end of the year, would you owe anything if you switched to a new company? Was that where you were heading towards? Okay. Again, any change within the household, be it income, be it an addition to the family, if you move to a different state, all of that information, any changes need to be reported to the 1-800 customer care number because it does affect the amount of your tax credit. You don't want to be put in a situation where you're receiving a large tax credit up front and you end up earning more and you don't report it and now they're coming knocking on your door looking for a refund. So it is very important to report the changes.
Did that answer your question? Yes? Okay. Ben Anderson in the back has a question.
Hello. My name is Ben Anderson, and my question is, I'm working in the shopping field, and I make $20,000 a year. And I've also been a patient grading, and I want to know how will the healthcare act affect me.
Are you a current grading patient?
Yes.
So if you currently qualify for a grading card, you will still qualify for a grading card in the future. And the amount of out-of-pocket that you would owe under an exchange plan, so if you choose one of these plans and you have an out-of-pocket expense, we are planning on writing those expenses down to your current grading copay level. So if you pay $10 for an outpatient visit now, you would pay no more than $10 for an outpatient visit in the future. There are some exchange plans who have no copays once you reach your deductible. So shop around because there are some really good deals out there to be had. They all have to have the same 10 basic elements of coverage. So we encourage you to shop. It can be a little daunting. There's a little, but there are navigators and groups that can certainly educate you on any of that. And there are lots of people here in the room that can assist you with that as well. So yes, you will still be eligible for a grading card, and you will still receive financial assistance in grading your card expenses.
Do we have any more questions for our panelists? Just raise your hand. No, we have one up front. You come right here. Hi, what's your name? Vanette Forbes? You guys are being shy. I'm gonna hold it right here, okay?
Okay. I'm 64 years old, and 2 years ago I had breast cancer, and my insurance that I did have with Kaiser it wasn't enough. So anyway, I get help with speech here. And about 5 months ago, I was going to the doctor to see the, get checkup and go to the radiation doctor, but the insurance, they dropped me. I came here to go to see a doctor, so I'm trying to get the insurance. I called twice, the Obamacare, they said, one time they said I'm eligible for a 4,000 something tax credit, and my payment would be $20 something, but something happened to the company. They said I have to call back. When I called back again, the next person told me that I'm qualified for 4,000 something, but my payment is $375 per month. And I said I can't pay that.
I think that deserves a little more exploring. I would be more than happy, and any other navigator within your community could explore that further. There could be a number of reasons why you've been quoted 2 different tax credits or premiums, etc. So that just takes a little more exploration. And again, I'd be happy to assist you. Brady's Navigators would be happy to assist you. And depending upon whatever area you're in, there are licensed, certified navigators or community certified application specialists that could help you explore that some more. Okay?
Thank you.
Any other questions? Going once. Going twice.
3 times.
All right. Listen, we want to thank everybody for coming out tonight and sharing your time. We got a lot done here on this evening. And because we know that somebody may have a question that they didn't want to ask out loud in front of everybody, our wonderful panelists, would you give our panel a hand? Yes, them private. But thank you so much for coming out on this evening and supporting News Talk 1380, WAOK, and V103.
Thank you. I'm going to let you know our next healthcare forum will take place at Marine Christian Center in Stone Mountain. You can log on to v-103.com or WAOK.com for links on Affordable Healthcare Act and the video you saw tonight. You're next.
I think that brings it to an end. I'd like to bring Jean Ross the microphone. She probably wanted to whisper in my ear, but you tell my mother.
I just wanted to add that the next healthcare forum is going to be January 15th at Marine Christian Center.
You're right.
There you go.
I didn't see that part.
And thank you again for coming out. Spread the word because, we know that a lot of people have a lot of questions about what's going on. You guys asked some great questions tonight, very specific, and that's why we hold these forums so that we can bring you the experts who can answer your questions for you. So if you know somebody that you think, they may have some questions, they need some information, January 15th at Marine Christian Center, we'll be looking for you.
All right, again, it's Ramona Mills, Southside Medical Center, Rick Ryan, the Money Man, Grady Health System, Dante McKay, Enroll America, and the Harvard-trained lawyer, Erica Long, the Long Strategist. Thank you all so very much. And thank you.